poster presentation is regarding our site-wide training, creating a culturally inclusive environment in an integrated care setting. My name is Brittany Zettler. I am a master's student at the University of Cincinnati, and I am studying clinical mental health. My internship was at IKRON. IKRON is a community-based agency that focuses on both mental health services and vocational services.
And hi, my name is Lauren Luna. I am a student at UC as well, studying to be a mental health counselor. And I was at the Health Resource Center for my internship. Both IKRON and HRC, Health Resource Center, are housed under the same building. So Brittany and I have been working together on this project.
The objectives of our leadership project include recognize the need for cultural humility in your profession, gain self-awareness of cultural biases within your day-to-day work, and to develop tools and abilities for continued growth in cultural humility. So to provide a little bit of background regarding this topic, minority populations face health disparities, in order to provide training to help promote cultural humility, that's one way to help alleviate the potential for increased health risk for that population. The Affordable Care Act promotes integrated care models to decrease both physical and mental health disparities, and HRSA, the Health Resources and Services Administration, has been tasked with providing training opportunities to help reduce health disparities. There are ethical guidelines to help inform professions, and within the integrated care setting at both IKRON and HRC, there are several different professions housed under the same roof. We have nurse practitioners, counselors, social workers, and career development staff. And so all of these individual professions are all tasked with promoting cultural sensitivity within their day-to-day work as defined through their own ethical guidelines. Providing a description of our project, we started out by conducting a needs assessment with both IKRON and HRC participants through focus groups in order to identify areas for growth in order to improve cultural inclusivity in delivery of services. From that, a cultural inclusivity training was developed for both IKRON and HRC staff, and the training aim was to promote mental health and wellness for all clients who receive services. Both Lauren and I utilized a literature review in consultation with IKRON LPCC. We had another individual from IKRON help with this training as well. And in addition to the Assistant Director for Division of Equity, Inclusion, and Community Impact from the University of Cincinnati, who also provided influence for our training. We had an hour-and-a-half training on cultural inclusivity for all the staff, and the training was offered both in person and virtually thanks to the limitations of COVID. Topics covered in the training included definition of culture, ethical guidelines for multiple profession disciplines, health disparities resulting from cultural differences, increasing cultural inclusivity, as well as tools and resources for continued growth in cultural humility. Pre-test and post-test were provided to all participants. Our targeted population included trainees, our staff trainees were licensed professional counselors, social workers, counselor intern, social work intern, nurse practitioners, and career development staff.
Thanks, Brittany. We're going to move on to the results of our pre-test and post-test scores. So all individuals did receive a survey before taking the training and after taking that training as well. So we saw improvements in the participant average scores from pre to post-test in areas of comfort, awareness, preparedness, and commitment to utilizing cultural inclusivity in their practice and in their interactions with the clients at IKRON and HRC. We saw significant changes in 2 of the items. So in the areas of comfort and awareness, we saw significant changes and increases in their scores there. There's no change on the average score for the item of understanding cultural inclusivity. The graph below shows these score averages from pre to post-test survey results. So moving on, we'd like to share with you a little bit about some of the impact of this training at our site. So the training presentation and materials has been provided to the director of IKRON and HRC for further and future use with staff and interns. So we hope that this is something that can be utilized as a way of really helping people to improve or learn more about cultural inclusivity and to become more comfortable in using cultural inclusivity and working with individuals at the site. We also want to mention that participants were provided with tools and resources in the actual training itself to be able to take with them into their practice and to continue to allow for growth in cultural humility. We really wanted to add in just some various media in order that would be informative about different cultures. And so we've included that in the training as well. And we hope that that is something that the employees of IKRON and HRC can use together and learn from together. So some of the implications of our test results. It's showing that this training can be effective in increasing comfort and awareness of utilizing culturally inclusive practices. We also see how training can be beneficial for individuals with lower cultural competencies. So a lot of our participants really scored pretty high to start with at that pre-test survey. And so we're thinking that this training, we might see some more significant differences from pre to post-test scores had we been working with people who might score lower to start with in these different construct areas. Moving on to some limitations of our training and our research. We do have a very small sample size. It's a small agency, and so we want to acknowledge that small sample size. Our sample also scored high. Again, we scored high on those pre-tests, so there's a bit of a range restriction here that we're working with. And we also do not have an experimental design, simply a program evaluation. All right, so I'd like to move on to just acknowledging everybody who worked with us and really provided support and gave us a lot of their knowledge that we're so grateful for. So Melissa Harmeling and Randy Strunk, they both, Randy Strunk is the director of IKRON and HRC, and Melissa is in charge of a lot of the employment services at IKRON. They have provided us with guidance. We worked with Melissa throughout this process, and she really helped us work out all the logistics and everything. And Randy really helped open doors for making this happen. We needed his sign off, and so we are grateful that he was interested and supportive in this. And Randy was also really great about wanting our materials for the future, so this could hopefully benefit people to come. Hannah Russell is the counselor who worked with us in actually implementing and developing this training. She's so passionate about this subject. She started working with us after Brittany and I had been meeting for a while on this project, and she came in with tons of resources and tons of trainings, materials that she had engaged in the past around this topic of cultural inclusivity and cultural humility. So it was so great to have her perspective and her all the information that she's learned through this process to be added to our collaborative effort. Deanne Marino, she worked with us and really helped us feel comfortable and understanding or knowing if our training was appropriate and if it was accurate. We really want to be accurate and working with cultural inclusivity. And so Deanne Marino is an employee at the at University of Cincinnati. Brittany had mentioned her earlier in the project. She sat with us for a good amount of time and just helped us take a look at our materials for the training and let us know if there were any issues or areas for growth there. So we're really glad that we had her expertise to help us out there. And lastly, but not least, but we want to thank Dr. Michael Brubaker for just providing support throughout this entire project in any way he could. He's been really great and really encouraging throughout the entire time. So we really thank you, Dr. Brubaker, for providing that support and assistance with developing our capstone project. Here you'll see the references that are cited in this poster presentation. And if anybody has questions, we really look forward to seeing you guys and hearing from you all at the question and answer. Thank you.
Thank you.